And this is just a brief introduction about the adrenal gland. So let's go ahead and start here on a case. So Mrs. D came to the hospital due to not feeling well, fatigued, and nauseous. The patient denies that she's on any blood pressure meds and her blood pressure at rest is 90/60. So her blood pressure is low. BMP significant for sodium of 120 and potassium of 6.1. Random cortisol is abnormal and is very low. What do you think about this patient's diagnosis and how would you treat this? So let's think about the physiology we just talked about here, okay? So speaking from an adrenal gland standpoint, we're thinking this patient is not septic. Septic patients come in with hyponatremia, tachycardia, etc. Well, this patient's blood pressure was low, the sodium was low, and potassium was high. When you always see this combination, you got to think about adrenal gland insufficiency. And again, we're going to divide this case here in two parts. So the first part is that her blood pressure is low, okay? The sodium is low at 120 and the potassium is high at 6.1. What does the aldosterone do? The aldosterone absorbs sodium and releases potassium and makes your blood pressure high. Well, when there's no aldosterone, your blood pressure will be low. Your sodium that the aldosterone absorbs is not going to be there, so the sodium is going to be low. The potassium that the aldosterone releases into the urine is not there, therefore the potassium goes up. So there is aldosterone insufficiency here, okay? So that's the first part. The second part, random cortisol is abnormal. So that's we're talking about the glucocorticoid part here, and that's also abnormal. And when the patients have low cortisol, these patients feel fatigued, they feel tired, their blood pressure will also be low because like we said, the cortisol has a part to do in the vasoconstriction and releasing catecholamines. So that's not there. So in this case here, you have what we call adrenal insufficiency. And with the blood pressure being low, you can also even call it adrenal crisis because these patients are almost in shock.